Hey guys, it's HINA Chef here at Rebalance Physical Therapy in Philadelphia, Pennsylvania, and on the main lines in Narberth, Pennsylvania. And I want to reach out to those who are kind of irritated by chronic nagging, what feels like hamstring pain. And we, again, at our clinic, we specialize in the hip, pelvis, the low back, and the pelvic floor. And in our practice, what we find is we see a lot of clients who are coming in with kind of unrelenting or chronic, irritating, what feels like hamstring pain. They may have tried a lot of different things from, having physical therapy, seeing chiropractic, going and doing core strengthening, things like that, but they're just not having either permanent results, maybe they've seen a little bit of progress, or, maybe nothing at all. And so I kind of wanted to talk to you a little bit about other things that could be going on besides the hamstring. Now, maybe you're an athlete, maybe you're not, but perhaps something may have started with a hamstring irritation. Maybe you pulled it with running or something like that. But usually what ends up happening is, unless you're really doing an activity that's out of the ordinary for you, usually when you end up irritating the hamstring area, or what feels like it, usually it's not the hamstring itself. Usually it's because the hamstring perhaps might be involved, and it's compensating because something else in the system isn't working right. So I wanted to show you guys some pictures. I love my pictures. Okay, so here is a photo of the hamstring area. Okay, so we're looking at the back of the leg. This is the hamstring area, okay? And this is where you might be feeling like you're having, again, hamstring pain. Maybe it kind of feels like sciatic type pain, okay? Or vague symptoms into the back of the leg. But you can see here that the hamstrings are attached up all the way up here onto another bone. And this is part of your pelvis, okay? And part of your, hip is right over here. But way up above here is your pelvis. And a lot of people think, when they think hamstring, they're thinking, oh, the hip is involved, but the pelvis actually can be involved. And all of the musculature around the pelvis, in the front, in the back, on the inside of the leg, on the outside of the leg, including up into what are known as the sacroiliac joints and even into the low back, can play a role in chronic irritation behind the leg that again feels like it's coming from hamstring. Now, other things can also get involved, the foot, the knee, all those sorts of things. But today I'm just going to kind of explain to you what's going on in here, okay? So now, right over here, I'm not sure if I explained this to you, but this is the pelvis, and on this pelvis, this big red muscle is called your gluteal muscle, okay? Now, that glute muscle, if it, again, has been compensating itself, it's been overworking, maybe you've had other injuries in the low back or whatever that has kind of fed issues into that glute at some point in time, what you may experience, again, is symptoms that kind of look like this. Now, the glute muscles can actually end up having something called trigger points, and those trigger points, if you look at here, okay, they're different areas that if they get irritated, it can give you pain, not only in the buttock, but look at this, it can give you pain in what feels like could be the hamstring area, okay? So some people that might be getting work done on their hamstring or strengthening or anything like that, and it's not getting better, it could be coming higher up into some of those glutes. But again, why is that happening to the glutes, okay? And you got to look at the front of the musculature as well, in the pelvis as well as in the hips. So if you look at this photo in the front, okay, there's the abdomen. Again, these lines in through here are the front part of the pelvis. There's your pubic bone. You have a lot of muscles in the front of the hip too. And if they are imbalanced, okay, then your hamstring or your glutes might be compensating for, whatever activity that you're doing, okay? And it can be, again, high-level activities such as some sport, or it could be something just as low as walking or going up and down the stairs, and that's what's creating symptoms, okay? So a lot of the times, many of the times, these muscles can be imbalanced, again, including the front, okay, symptoms, or not symptoms, but muscles around the groin, the hip flexors, the inner thigh muscles as well, and sometimes even up into the abdomen, and deeper within the abdomen, there's a lot of musculature too that can play a role in hamstring pain. So going to the back, okay, the other things that might be going on, okay, if we peel that glute muscle apart, so the previous picture that I showed you, if you peel this gluteal muscle apart, you can see that there's a lot of other muscles underneath that glute. So some of these muscles could be also referring pain down into the hamstring. And two of these muscles are actually part of what's called your pelvic floor musculature. Okay, and that pelvic floor is actually part of the inner pelvis, which I'll show you in a minute. But you can see this yellow nerve, sort of looking thing that's coming down. That's your sciatic nerve. And many times, again, if you're having any type of imbalances around the glute, around the hamstring, in the front of the hip and the pelvis, as well as the pelvic floor, that could be getting involved. And we see lots of patients where that is the case. Not all, but many times. Okay, so if we dive down further into the pelvis, okay, and we're looking at this structure over here. So again, there's part of your glute muscles. Okay, we're looking at the front. Here's the pelvis now stripped away of all the external muscles, including the abdominals. And here, remember those two white lines I was talking about? That's right here. But if you look inside the pelvis, there's a bunch of other musculature here, as well as in here, that all actually have connections. Some of them, actually not all, have connections into the hip, but they all have connections to the pelvis. So if there's any issues around the pelvis, it can definitely affect the hamstring and the way that it's functioning, or the gluteal muscles, or any other muscles for that matter, okay? But if you look further up, okay, you also see that there's a bunch of other muscles that connect from the pelvis to the low back, and on and on and on. And this is how we are all interconnected, and we shouldn't be looked at in parts. We should be looked at as a whole human being, and how, injuries from the past, even if they started, say, in your low back, or even in maybe your head and neck and shoulder, and how that might have trickled down into issues now, what feels like, in the back of the leg or in the hamstring area. So you don't want to neglect any of the past things that may have happened that may have led up to this incident. And then, so just to kind of show you lastly, okay, when you're thinking of, how the whole body functions, okay, and we're looking at, here's the guy who's kind of just walking along, and they're showing movements in basically what's called gait or walking, okay, you can see how everything from the foot all the way up into the pelvis and into the shoulders are all interconnected together, okay? And we use the upper body as well as the lower body to propel ourselves forward. And so even if you're having pain in here, there's many times where the whole system all the way up can be involved. And I wouldn't say it's always the case, but it's not uncommon for that to happen. So I hope this video was helpful for many of you, just to start understanding what could be going on. Now, of course, I'm sure you're like, HINA, that's great that you explained that to me, but what can be done about it? Now, most of the time, you really do want to see a skilled physical therapist that really understands how all of this is interconnected together. And this is what we kind of do here at Rebalance Physical Therapy. So if you don't live in our area, then obviously you want to try and find someone in your area. Here at Rebalance, especially if you live in the Philadelphia area, this is what we see every day. These pelvic hip, pelvic hip and low back issues, and how many different symptoms, everything from pelvic floor related to, again, this video is about hamstrings, so hamstring related pain, how all of that can be interconnected together. So you really need somebody that truly understands how to work on the soft tissue, meaning decreasing all the either compensatory spasming that's happening in all of these different muscles. And then also, once that has improved, how to then work on any of the joints that might be also restricted or not allowing good movement of this muscle. And then obviously how to train these muscles and coordinate them all together so that you can basically get all the muscles, kind of synchronized together so that you're basically performing well. So that's really what you need to do, especially if some of you guys have gone out and you've tried foam rolling. Maybe you've tried to go, get some core strengthening done and that hasn't worked. And obviously give that a try first. But if that isn't working for you, really you need to be seen by a skilled physical therapist and that's where we come into play. So if you guys have any questions, or if you want to learn a little bit more about us, come to our website. It's www.rebalancept.com. There's lots of other videos and helpful information, and we will hopefully see you soon. Take care.